morning, everybody. Welcome to week 3, day 1. We are almost through the lecture portion of this session. Well, shall I say this whole cohort? And we're going to go ahead and keep rocking and rolling. As I always mention, if you have any questions that need to be answered, feel free and do not hesitate to ask so that we can make sure we answer them for you. All right, so today we're going to discuss communication. We're going to identify methods of communication. We're going to learn how to communicate effectively with our family members of the facility for the patients and our coworkers. We're going to learn how to deal with the difficult topics. We're going to define and identify how to report and record. And we're going to learn how to communicate on the telephone. All right, when it comes to communication, we give and we receive information. So as CNAs, we got to communicate effectively with our residents and other staff members so that they can understand what we're trying to tell them and they can pass the message along properly. When we're senders, we give information called a message. And when we're receivers, we receive that sender's information and we make sure we confirm it. That way we get the proper information that we're going to pass along to somebody else. Methods of communication. We got verbal communication and nonverbal communication. We're going to go ahead and jump right in and talk about the difference of the two. With verbal communication, it could be spoken, written, and sign language. That's actually speaking something, writing something that comes from our brain, and actually sign language and something which is actually communicating without words. You got nonverbal communication, which is our body positioning, our gestures, our tones, our facial expressions. That's how a lot of people read our auras and how we feel throughout the day. So if you come in and you look down and depressed or angry, it's going to read from nonverbal communication. And even though we're saying something, our body language is saying something totally different. When we communicate effectively, we got to listen well. We're going to be active in the conversation. We're going to be observant. We're going to make sure we deliver clear messages. We're going to use nonverbal messaging so that the messages that we do deliver verbally are clear. We're going to confirm, and we even use touch if necessary. When we're making our message clear, we just want to speak in a way that that person gonna understand us. So when a doctor come in and tell somebody that they had a myocardial infraction versus having a heart attack, they're gonna look at us crazy. But it's important for us to know exactly what the doctor is communicating to our residents so that if they don't understand those medical terms, we're able to break it down for them so that they can understand it and they can move forward with making decisions about their health care. We want to be conscious on what we say and we want to say what we mean. If we're writing something down, we want to make sure it's neat. It has to be in blue and black ink. That's just a professional way to go. And we must spell correctly so that we don't mistakenly think one word is for something else because that can happen. When giving confirmation, we give and we receive confirmation. So when we're giving it, we want to make sure that we ask. So you want me to tell the nurse such and such, such and such, such and such, just to confirm. And then when we're receiving it, we're going to ask them, hey, can you repeat that back to me? Or I'm going to repeat that back to you so that I can make sure I got everything that you told me. When being active in the conversation, we're going to give our senders our full attention. We're going to listen and we're going to respond when it's appropriate. We're not going to cut that person off. We're going to make sure we give them time. We shake our head when it's a proper time to let them know that we're listening and understanding. We're not going to interrupt so we can show that that conversation is important. And if we don't really have enough information to run with, we're going to go ahead and ask for more information to show that we was listening, but we want to make sure that we got everything that they meant to tell us. When it comes to nonverbal messages, we have to be aware of what our body language says to a person. Like I mentioned before, we can be saying something to a person in a mindful tone, making eye contact with them, but do our body language match what we're saying? So if we're going into Miss Jones' room and we're looking at her and telling her, yes, ma'am, I understand, I hear you, I'll do whatever you need to do, but our body language says, oh, I'm tired. I wish you'd stop calling me. I want to hurry up and get out of here. She's not going to believe what we're saying. She's going to think that we're just ignoring her and we're brushing her off to the side, and we really do not want that. That's what make our residents get feisty with us and angry with us and stop letting us help them. When it comes to touch, it's just a support of what we're saying. And again, depending on the background, it could be offensive to some people. It could not be offensive to some people. So watch how you maneuver around when it comes to touch. It could be a pat on the back, a hand on the shoulder, rubbing of the back slightly, a hug, or holding hands just to let them know that you have them and you support whatever you're trying to tell them. So if you're telling them, yes, ma'am, I totally understand and I do feel sorry, and you're holding their hand and just gesturing them to let them know that everything is going to be okay, that's appropriate. But you don't want to do anything without permission so that they don't say that you touched them in the wrong way or harmed them and it really wasn't meant to be that way. Communicating with patients. You got visual impairment, hearing impairment, and some difficult topics that we may run into. When it comes to visual impairments, you got some conditions and illnesses that we're going to run into, which is diabetes, strokes. Some people have cataracts. With diabetes, it's a disease in which the sugar of the blood levels are too high. And with strokes, it's a sudden interruption in the blood supply to the brain. Then we have cataracts, which is a cloudiness of the eyes or the natural eye lens. These we will experience throughout our healthcare career because everybody is here to get help no matter what they're going through. So we just need to know how to maneuver around in certain situations. With visual impairments, what we're going to do as a caregiver, when you're doing skills, you're going to learn this firsthand so that we know how to communicate with our residents and make sure we get the goal to continue to do what we need to do. So we're going to knock first. That way we don't startle them when we come into the room, and we're going to stand where they can see us. We're not going to stand back at the door and start talking to them because they may not see us or understand who we are, and then they'll be startled and worried about what's going on. We're going to stand eye contact with them. We're going to describe what's going on around them. We're going to describe what we're going to do. If they want to know what's going on, we're going to paint a mental picture for them so that they can be comfortable with us in the room with them. We're going to tell them everything we're doing beforehand and then while we're doing it. And we're going to encourage them to hold our arms as a guide if they need to. They may not need it, but we're definitely going to let them know to go ahead and hold on to us. When it comes to hearing impairments, we got Meniere's disease, we got acoustic neuroma, we have aging, we have acoustic trauma. Meniere's disease affects the inner ear. Acoustic neuroma is a tumor which causes hearing loss. Aging causes hearing loss. And we have acoustic trauma, which is caused by loud noises over a gradual amount of time, or even a instant if it's like a big boom or eruption that's just right there by your ear. Do as a caregiver again, just like we're going to knock on the door, wait for them to tell us to come in, and then walk up to them. We're going to approach that person from the front and touch them slightly so they know that we're there and we can get their attention without startling them. If one ear receives sound better than the other, then we're going to stand on that side that they can hear us best. We're going to keep our hands away from our face and speak slowly and clearly just in case they're reading our lips. And we're going to rephrase stuff that they don't understand. So if they say, can you repeat that? We're going to make it to where they can understand the words we're using, the sound that we're producing off when we're telling them what we're going to do. And we're just going to reduce distractions and background noises. So we want to make sure that we're right in front of them, communicating with them as slow as possible, but not too slow to make them feel away, and just give them time to understand what we're saying. When it comes to difficult topics, we're going to always feel like we're in an awkward position because it's some things that we get told that we might not understand or we might not like to hear because it's a hard thing to deal with. So when you go deal with a resident and they have an issue, they could be saying, my family doesn't care about me. That's why they dumped me here. Or you can get a family member that's just exhausted and say, she's been sick so long, I wish she'd just die. These are topics that we just don't want to be involved in. We want to let the nurse handle or the doctor handle because we could say something that might rub somebody the wrong way, and we just really don't want to deal with that. All right, so when we hear these kind of situations going on within our facilities, we're just going to give them our full attention. We're going to gently touch their arm or shoulder if it's appropriate, just to let them know we understand and we care what they're coming from. And we're going to urge them to say what they really mean and offer a help or solution so that when they do express everything and get things off their chest, we can go to our nurse or the doctor or the person that can handle these situations, and we're going to explain what they're talking about so that they can pull them aside and help them or offer them different solutions to make their situation pretty much better. So when you hear somebody say, my family doesn't care about me, that's why they dumped me here. As a CNA, we could say, it sounds like you really missed them. What if I helped you write them a letter this afternoon? Would you like that? Would you like me to help you, get in contact with them? Is that something that we can do? I can ask the nurse if we can find a solution for that. Would you like that? We just want to offer different ways to make them feel a little bit better instead of feeling down. When we get a family member and say, she's been sick so long, I wish she'd die. As a CNA in a facility, we're just going to let them know. It sounds like you're a little bit exhausted from all of this stuff. Have you spoken to a family counselor that we keep on staff? It's ways that we can go ahead and get a few things off your chest so we can help you regulate what you're feeling so that you won't be feeling those things. If we're in a home healthcare situation to where we're in somebody's home and don't have anybody to lean on, we can mention, it sounds like you're exhausted from all this. Have you spoken to anybody about respite care? You have to you deserve a break every now and then. So if that's something that you would like to do, we can go ahead and speak to the supervisor and we can get that started and put in place for you. And for those who don't know what respite care is for the family members to get a break from taking care of their loved ones for a long period of time. It could be 2 hours a day to get them time to go outside the house and go grocery shopping or do something that is beneficial to them to keep them from being exhausted. It just gives them a little bit of hours throughout the day to go ahead and focus on themselves. When it comes to new information, we're going to teach and we're going to reinforce that information to our resident. So when a nurse or a doctor gives some information to our patient, we as CNAs need to know exactly what they're talking about. So when the conversation is over between those two, then we can go in and if she asks us a question about it, we can better explain it. It's a lot of medical terms that's going to be thrown out and residents just really don't know what that means. And we need to be able to break it down. We'll be with our patients the most. So we just need to be able to simplify a lot of information that they're going to be given that's pertinent to them increasing or improving their health and moving forward. When it comes to communicating with families, we're gonna show them that we care for their loved ones by the care they receive because we love what we do. We're gonna explain why we do some of the things that we do when it comes to taking care of their family members. We're gonna talk and learn a little bit more about the family, and it's gonna build trust so that they can come in every day and they know that we're on shift and know that we're gonna do our job and take care of their family member. We're gonna be open about their comments and tips. So if they come in and say, "Well, can you do my mom this way?" or "My mom would prefer this," or "She needs an extra something," we're going to go ahead and grant that wish. They've been working with them before we started working with them, so they just feel like they know a little bit more than what we do when it comes to comforting their family members, and that's absolutely okay. And we're going to always remain professional. Yes, we know what we're doing. Yes, we certified for the most part, but we can always let them give their opinions and make them feel better as well. When we communicate with our coworkers, we're going to use medical terms, abbreviations, and acronyms. We're going to report and we're going to record so that everything can be documented and we can share notes back and forth when it comes to working with certain patients. All right, so we got a scenario that I want you guys to look into. After this, I want you to tell me how you guys would respond or discuss how you guys would respond and how you report this comment so that we can move forward. Okay. When it comes to recording, we write down a lot of our information within medical records. We write charts. We do care plans. We follow flow sheets, and we have nursing notes for anything that we need to pass on that we can't communicate at the time. But we can definitely make sure they have a note in the system so when they log in, they'll be able to see it. When we talk about care plans, we discuss what kind of care they need, how that person going to receive the care, what's used to give care to them, and how many times this method needs to be repeated. This is going to be checked every day, so we're not going to assume that our patient is getting the same kind of treatment each day that we work with them. Something may change or transpire within their healthcare plan, so we need to do something a little bit different. It's always important to make sure you check your charts and look over the care plan just in case a diet has changed, just in case the way that we give bad baths have changed, just in case the way we transfer them have changed. We don't want to assume again. We want to make sure we know exactly what we're doing before we move forward. And this can be on a computer or on a file that we read. When it comes to flow sheets, this is just how we track measurement changes, like the weight, the input of what they ate or drunk that day, the output, how they urinated, how they um, allowed feces to flow. We check blood pressures, we check temperatures. Sometimes um, we'll go ahead and get different a lot of different things that's going on, like sugars, depending on the facility that you're in. So it's really important to know exactly what you're taking and document it. When it comes to nursing notes, this just share a lot of details about the person's condition, whether they're recovering from a stroke, what kind of care they're going to receive, whether it's range of motion on the left leg or the right leg. Um, they use the facilities. We chart whether they have voided or had a bowel movement because that's really important in making sure they regulate a daily healthy life moving forward. And it's important events that took place, such as she scratched herself down her arm or she hit her leg. That's something we want to know so we don't think that somebody is doing something. It's charted, it's noted, and everybody knows what's going on. They could be a fall risk and we thinking something else. So if it's in the notes, then we can go ahead and look over it and see what exactly happened instead of assuming. When it comes to recording, if it's not documented, it did not happen. So we want to make sure we fill it out correctly and make sure we read what we're filling out so we know we're putting the right information in the right spot. We're going to be accurate about what we're putting on the information. We're going to talk about um, whatever is on the document and who we need to give it to so that we know we're passing it to the right person. We're going to document what care was given and how it was given so that when it's time for them to be billed, insurance can bill them properly. We're going to use certain ink, whether it's black or blue, but it's mostly going to be black, and we're going to always initial and sign when it's necessary. This form of documentation just lets them know that we're doing our job, we did our job properly, we did everything we were supposed to do, and if it's something that didn't happen, we documented that as well so that we can make sure we follow up on the regimen. All right, when it comes to time, we use a 24-hour clock in healthcare. It just helps differentiates the time between AM and PM. Basically, when it comes to bathing, when it comes to medication, like when we work in a hospital in a facility, we have 24-hour care. That's not necessarily 12-hour care, 12-hour care. It's all 24 hours. So we work around the clock. We don't want to confuse 12 a.m. medication with 12 p.m. medication. So they go ahead and they use military time. This is just an example of how military time is used. We're going to add 12 afternoon just to go ahead and add the hours up together. So once we hit 12 o'clock p.m. and 1 o'clock p.m. come around, we just add 12 to it so that it's 1,300 hours instead of 1 o'clock p.m. because that might miss up somebody who gave 1 a.m. medication and they accidentally put p.m. instead of a.m. When it comes to professionalism, we want to make sure we take accountability, take responsibility for our different actions, our mistakes, and we work to rectify them. So if it's something that we did that we know is wrong, we go ahead and fix it. We don't leave it for it to be wrong and somebody else to fix. We go ahead and take charge and fix what we did. We're going to use integrity. We're going to always be honest as possible. I know sometimes it's hard to stay focused, but honesty is the key to keep on going and make sure that you're respected and that your day flows smoothly. We're going to use respect, which is making sure our colleagues and our clients get the utmost courtesy and consideration when it comes to care and working together. We're going to have competence. So we're going to make sure we got the necessary skills and knowledge to do our job. If we don't know what we're doing, do not hesitate to ask for help. It's always okay to get help from somebody because you don't know something. You rather not know something and let somebody help you versus not knowing something, doing it, and messing it up even worse. Adaptability. We just want to be adaptable. When things change, which they will, we want to learn how to go with the flow and keep on moving and learn new things as we're moving along. It might be something that we never learned before, but we're going to learn it today. That way we can go ahead and take that with us if it ever happen again. Communication, just making sure we communicate clearly and effectively, verbally and written. That way everybody can process information and pass it along properly. And time management, we just want to make sure we're punctual, we meet deadlines, we on time, we taking care of our shift within a right amount of time. We're not leaving patients for hours, worried about other stuff that's not really necessary or pertinent to what we're doing for the day. When it comes to phone use, we're going to be professional, identify ourselves. We're going to be courteous and take messages. We'll be discreet because we need to remember the policy. So sometimes we may be sitting at the desk charting and the phone rang and there's no nurse to answer it or nobody in HR or the front desk to answer the phone. So it comes to us. We're just going to answer. Hello, this is LaKeira speaking. How can I help you? We're not going to tell them what department we're in, what area we're in. We're just going to introduce ourselves and get as much information as we need. When it comes to courtesy, we're just going to be polite. It's part of our job duties. It's not nothing that we're forced to do. We have to do it. We want to be as polite as we can so that our patients and our patients' families feel like they can open up to us and they can give us that same respect back. We're going to answer the phone as soon as we can, and we're going to speak clearly and slowly. That way, if we're giving information, somebody can take the information down correctly. And if we're receiving it, we're going to verbalize that, okay, we have this information. I'm going to report it back to you to make sure I got all the information, and then we're going to give it to who it's supposed to be given to. All right, so as a CNA, we're going to always identify ourselves and tell who we are and where we are when it comes to answering a phone as well. So we're going to, hi, my name is LaKeira. I'm a CNA here. I'm working on 3 West. How can I help you? That's all the information we need to give out. We don't want to say that we're with a specific person, or yes, this person is on this wing, or yes, this person is in this department. If they want to speak to that person, we'll give them let them know, hey, I'm going to go ahead and I'll put you on hold. Let me grab your nurse for you, and then they can give you more information. I don't have that kind of information, and move forward. When we're taking a message down, just in case a nurse is not available, we're going to get who called, when they called, the date and the time. We're going to talk to who they spoken with, what's the name of that person, who they wanted to speak with, why did they call, what do they want, are they expecting a call back from us, or will they call back? If so, when? We want to make sure we take as much information down as possible. That way, when a nurse comes back, we can give her the information and she know what to expect moving forward. When it comes to privacy, we are not giving out any kind of personal information. So, although you may have taken all of this information down, although they are so adamant about talking to a resident or a patient or getting information on a specific patient, we don't share anything. We're not confirming that that's our patient. We're not confirming if they're there. We're not giving any personal information out over the phone because that's not our job. We're going to always respect that person's privacy. It might be a person that they don't want to know what's going on or where they are. So if we give that information, that might go against the law. And we don't want to be the person to go ahead and break that law. All right, so as a lesson recap, we talked about all of these things that you see: objective observation, subjective observation, what should senders seek from receivers, verbal and nonverbal communication, care plans, flow sheets, and nursing notes. When we check and understanding, we just want to know, why is it important to record and observe accurately and correctly? If you stated D, all of the above, that is correct. The medical record is a legal record of the care provided. Other members of the healthcare team rely on these medical records to evaluate that person's condition and make decisions about them moving forward. And then it's federal reimbursement. They pay for everything that we give them. So if it's documented, we want to make sure it's documented accurately so they're not charged the wrong way or charged for something that they never received. All right, when it comes to checking understanding, when we dealing with a person who is blind and we're entering their room, what should we do? If you answer B, that is absolutely correct. We're going to knock on the door, wait for a response, and then introduce ourselves. We don't want to knock on the door and walk right in and startle them because they can't see what's coming at them. So we're going to wait. If we knock on the door, Miss Jones gonna say, "Come in." We'll come in and we'll get right up to them and introduce ourselves. "Hey, Miss Jones, I'm LaKeira. I'm gonna be your CNA today. I'm coming in to change your bed. Is that okay?" We want to make sure we letting them know what's going on while we're coming in so that they don't be startled and they know what to expect. All right. So when we're taking messages as a sender, what should we do after we deliver that message? If you answer B, that is correct. We're going to ask for confirmation that the message was understood before we go ahead and hang up so we can make sure they understood everything that we told them. All right. So it's 2 o'clock in the afternoon. How would we express that using a 24-hour clock? If you answer C, that is absolutely correct. It is 1,400 hours. Remember, if it's 2 o'clock in the afternoon, 2 p.m., we're going to add 12, which makes it 14. All right, for checking your understanding, which of the following is subjective information? All right, if you answer A, Ms. Lyons tells you she feels sick to her stomach, that is absolutely correct. It's subjective because we can't feel it and we didn't measure it. So we don't know if it's actually something that's real or if it's something she's just telling us and wants to be checked up on. All right, you guys. Today we are completely done. If you have any questions about today's session, please feel free to go ahead and ask so that we can answer them to the best of our abilities. And we'll go ahead and see you guys on Wednesday. Have a great day.